Joined by Dr. K from All Valley Animal Care Center, and this morning talk about seizures in dogs. And I'm going to assume you'll have to tell me because you're the expert, but is it going to be pretty obvious if your dog is having a seizure?
Yeah, most people say, you know, something's wrong with my dog.
Okay.
And so most of the time people will when we see them, they'll say, well, my dog was okay and it just fell over. Okay. Pretty much, you know. Seizures can vary anywhere from a local muscle twitch to the grand mal seizure, which is most people, what is most people will see, and their dog's all right, and it just starts acting, stiffs up, falls over, and then starts thrashing, and it really scares people. Sure. Because most people haven't seen it, you know. and of course they call us, and then we say, well, you better come right in because that's what you should do. Okay. And then they bring them in, and usually by the time they even get to the clinic, they're pretty much normal in most cases. Okay, most of these seizures, I think from what you were telling me, not a whole lot to panic about necessarily. It's fairly common. Yeah, it's not that much to panic, but it's really freaky. Yeah. One of the things you do need to do is keep your hands away from the face and the mouth of the dog. I know they're your friends and their companions, but when they're in the hands of the seizure, they just really don't know what's going on, and anything that comes at them is going to look like they can't adjust to it very well. They might tend to snap, and you need to kind of comfort them and keep them from hitting their heads on whatever it happens to be. So you can slide like a blanket or something underneath it so they don't hurt themselves. But most seizures that most people see the first time will last less than a minute, and usually about 30 seconds, and it takes them 5 minutes or so to kind of get over it. Okay, so after that, you definitely want to bring your pet to the vet. What kind of tests are you going to run to try to figure out what happened here? Well, we do a physical exam and check their heart. Sometimes dogs with heart problems will have it, or we'll check their eyes to see what their pupils are doing. But in a large case, we do some blood work to check for things that can cause it internal, which would be like the glucose level, liver, kidneys, thyroid levels. We'll check those things. And that's mostly what we do, and just to see how things are going. If we don't see much, we assume it's some sort of brain thing. That most common is epilepsy. Okay. There's like brain tumors or liver shunts, depending on the age of the. So it really can range here from very serious to not a big deal. And sometimes they can get poisoned, but usually those type, they'll have a seizure and they might come up out of it, but they'll go right back in. It'll be like more consistent things. And the good news is there is medication for most of it that kind of help us so they don't have them as much. People get really weirded out when they see it. Naturally, I would think it can't be a normal thing to see or to expect. So, and, but that's a good thing. Most people do the things they should do. They call the veterinarian and we take care of it. Okay. All right. Thank you, Dr. K.